Evie Barkin has struggled with depression her entire life.
I didn't enjoy things like other children did. I just felt that there was something unusual because I was not happy.
Experts believe depression is caused by a combination of factors. Genetics or family history can make people susceptible to the illness. Chemical imbalances in the brain often contribute to depression. And life events like tragedy, loss, or emotional abuse can spark depression in any of us. Current research suggests most cases of depression are some combination of all three.
I had lost my job, my father had died, and I was just getting more depressed, and everything seemed to be going downhill, and I just didn't want to live.
Inside Evie's brain, scientists believe a chemical imbalance changes how a depressed person thinks. Our brain cells communicate with each other through electrical impulses. These impulses are messages sent from one cell to another. Normally, the impulse is carried across a small gap called the synapse by a chemical messenger called a neurotransmitter. For unknown reasons, people who are depressed have diminished amounts of the neurotransmitter serotonin. This shortage means critical mood-controlling messages fail to get communicated. In short, the message is sent but never received. Scientists believe this is the biochemical basis of depression. Evie's desperation led to a suicide attempt. She was hospitalized and began to receive treatment. Antidepressant medications were prescribed. Evie spent the next several years trying different medications until 1987 when a drug called Prozac became available. Prozac belongs to a group of antidepressants called selective serotonin reuptake inhibitors, or SSRIs for short. SSRIs work on the brain by improving the performance of the neurotransmitters. They increase the amount of serotonin by slowing how quickly it returns to the sending neuron. More serotonin means a greater chance the message will pass successfully from one brain cell to another. Prozac changed Evie's life dramatically. She discovered something she'd never known: life without depression. Medication has become the first line of treatment for depression. A 1997 pharmaceutical marketing study found 3 of the top 10 best-selling drugs nationwide were antidepressants. At the same time, some critics claim drugs for depression are overprescribed.
Hi.
I wanted to find out more, so I visited Sophie McIntyre, a neighborhood pharmacist.
There are several medications used to treat depression. Currently, most of the people who have depression are treated with an SSRI, such as there's medications like Zoloft, Paxil, Prozac, are the big names.
Okay, listen. There are several different types of SSRIs. Each one affects the neurotransmitters slightly differently, but all of them have side effects, including agitation, constipation, and stomach aches.
Some people can feel a little bit tired when they take medications. Those patients are generally advised to take them in the evening hours, whereas if the medication makes them a bit agitated or more alert, we'd recommend that they take it in the morning, because it is possible for one patient to feel drowsy from one of the medications, and then the next patient to maybe feel a little bit agitated from it.
SSRIs like Prozac and Zoloft are not happy pills. They don't make you euphoric. They restore your emotional equilibrium by repairing the chemical imbalance in your brain.